Input discharges can be shown as urethroregia after traumas or tumors. Pus is a sign of urethritis. Spermatoria in men without erection or osmoejaculation, it's a sign of damage to the spinal cord. Prostatorrhea is a chronic prostatitis, and hematospermia is inflammation in vesicles. Sperm discharge is dangerous situation and not well treated because, for example, oligospermia is a decreased amount of the sperm, necrospermia is a release of sperm with dead spermatozoids, hemospermia is the presence of erythrocytes or blood, or pyospermia is the presence of the pus in the semen. Should be treated fast and carefully. Now about tools of physical assessment. From the third course, you should know that 4 parts of this one should be known and provided, such as inspection, palpation, percussion, and auscultation, but auscultation is not very common in this branch of medicine. General inspection is a process due to seeing some changes in human organism, and it's a sign of some problems. For example, if a doctor sees a gynecomastia, we can think about alcoholism, hyperprolactinemia, and androgen therapy, etc. Endometrious organs, genitals and lower extremities can be a sign of heart failure, renal failure, nephrotic syndrome, or some obstructions. Anarchism, virilization, hirsutism, eunuchoidism, feminization are most common, common too. Supraclavicular lymphadenopathy is a sign of malignant processes in the prostate and ovaries, should be detected as soon as possible. Inguinal lymphadenopathy is malignant processes of the prostate, penis, and urethra, or different other organs in the small pelvis. In this picture, you can see gradation of gynecomastia according to the signs of the glands and the mechanism of nephrotic syndrome appearing. General inspection. Also, doctor can see smoothness of the waist, bulging in the lumbar region. It's a characteristic of paranephritis. Psoas symptom, it can be shown as the lower limb on the affected side is bent in the hip joint, brought to the stomach. The patient tries to move it with a minimum, also typical for paranephritis. In this situation, psoas muscle is affected. The presence of abrasions and hematomas of the lumbar region, as you can see here, it may be a sign and suspectable symptoms of kidney injury or trauma. Palpation also normally on the only the lower pole of the right kidney in children in asthenics can be palpated, as you see here. The kidney is accessible to palpate with the enlargement. For example, this one case, it's polycystic disease, is not only in kidneys but in heparin too. You can see here. Also, it may be hydronephrosis and cysts, or a downward position displacement, for example, nephroptosis in this case. You should know that Pasternatsky symptom is well known and well used. It's a soreness when striking the lumbar region. It's a characteristic of inflammatory diseases of the kidneys and perinephral tissues. The bladder palpation is important too, but normally it does not palpate and does not percussion if its volume is less than 150 millimeters. With an overflow over 500 millimeters, it can be determined visually in the form of a protrusion over the womb along the midline of the abdomen. By manual palpation of the bladder allows you to diagnose such cases as tumors, calculi, foreign bodies, diverticula, and changes in paravesical tissues. This one palpation can be and should be provided accurate and softly. Scrotum pain may occur, and you should know anatomics of this region. If you palpate scrotum, normally 2 testicles are palpable and they are ovoid shaped. It's a tie elastic consistency with a smooth surface, 6 to 4 centimeters in size. The appendage, its epididymis, elastic ridge along the posterior surface of the testicle, which continues into the seminal duct. This structure and anatomy you can see in such pictures and in the section of scrotum. Testicular pathologies are well common too. For example, a decrease in testicular volume is a hypogonadal condition. The mechanism of its appearing is in this scheme. Elastic formation with fluctuation, for example, some seals. Increased density, it's a malignant tumors, for example. Varicose veins of the papillary plexus can be a sign of varicocele, and edematous painful palpation can be a sign of epididymitis, epididymocarditis, or testicular torsion. You should remember about bronze system and differentiate different situations such as epididymocarditis and torsion. As you see decrease of pain, we can think about epididymocarditis and increasing the pain if a patient has testicular torsion. The next one is HYPOSPADIAS. It's a congenital case when the orifice of urethra is displaced, if it's first degree near the caput of penis, and the third degree to the basis. Normal one, hypospadia it is the back of penis, and epispadia on the anterior part. Rectal examination should be provided and should be well known by all urologists. Position for patient can be different. For example, lying on the side, lying on the back, standing with support of elbows, the knee-elbow position, and specific eagle position according to Picker. This is the staff and facilities for providing this procedure. You should know and use. Here you can see the anatomy and mechanism of providing this procedure, and here too the mechanism stages you should know. Rectal examination is difficult for some body of patients, but it should be provided. For example, lateral decubitus Sims position, and this is a brief information from Oxford University about rectal examination. Remember them. Doctors should know not only pathological states but normal situation. For example, normal prostate during palpation is in the distance of 4 to 5 centimeters from the anus and on the front wall of the rectum. Doctor can palpate to avoid slightly convex lobes, 2 centimeters long and 3 centimeters wide, a deepening of a triangular shape, apex facing down to the pelvic pouch. Lobes are painless normally, have a tight elastic consistency. The rectal mucus above the prostate is mobile and non-infiltrated. Here you can see the table which has the mechanism of assessment of prostate gland. For example, these grams from 10 to 60 and more grams. You can see it's called fingerprints. It's necessary to detect the changes in size to determine the disease. Prostate pathologies may be different. Firstly, it's benign prostate hyperplasia. The gland is enlarged, soft, elastic, well delimited, and the rectal mucus is mobile. But prostate cancer is difficult and more dangerous situation when the surface is heterogeneous, tuberous, and even stony in density. The contours are fuzzy. Each student should try this one because it should be detected and palpated, so this organ really is stony in density. Chronic prostatitis, the prostate is normal in size or slightly enlarged, but palpation is painful. Acute one, this organ can resemble a sponge. An abscess is a sharp limited soreness with severe fluctuation. Here you can see histological pictures of BPH. Features of examination in women should be remembered by everyone. Doctor can use meiosis assessment. It's a detection of papillomas, mucosal prolapses, paraurethral cysts, etc. Valsalva's test can be provided. It's a forceful bearing down which can cause excessive perineal descent. Also, doctor can use it for the detection of the cystocele or rectocele. to test for pelvic organ prolapse or incontinence. Also, a cough test can be provided for stress urinary incontinence detection. Here you can see a mechanism of Vassal maneuver. So this lecture was so generous for new facts for you, and I hope that your healthy body, healthy mind, and healthy spirit will help you to study well and be successful in this fourth course. Thanks for your attention.